Welcome. This is a streaming live meeting of the Health and Government Operations Committee. This is a briefing by the Department of Legislative Services, two separate briefings. First, budget overview of the Maryland Department of Health, followed by an evaluation of the state Minority Business Enterprise Program. The budget overview will be provided by Ann Wagner and Andrew Garrison, who are both senior policy analysts for our Department of Legislative Services. Would remind everyone, questions will be taken after their presentation under the usual committee procedures. So Ms. Wagner and Mr. Garrison, please proceed.
Thank you very much. So if it's all right with the committee, I'll share my screen to walk through the Department of Legislative Services analysis of Maryland Department of Health's budget. So today I'll be presenting a brief overview. I'll be clicking through this analysis on screen, but there is also a full report that can be found on the Department of Legislative Services website. So I'll just jump right in. So on page 2, this first chart shows the department's budget over the past 5 years. MDH's budget has grown pretty substantially from about $14 billion in fiscal 2019 to around $18 billion. And a lot of that has been due to spending and federal stimulus related to the COVID-19 pandemic. The fiscal 23 allowance shows a net decrease of about $625 million in total funds, as a lot of that one-time federal stimulus comes to an end. I will note, however, that state funding in general funds grows by about $650 million in fiscal 23, and that's in part to backfilling some of the federal funding. So this next chart shows an overview of MDH spending by how the funding is used. More than 85% of the department's budget supports healthcare in various forms. That's mainly through reimbursing providers under the Medicaid program. That covers about 66% of the department's budget. And then behavioral health services and community services for people with developmental disabilities account for another 20% of the budget. Moving on to changes in the governor's budget plan from fiscal 22 to 23. This table that starts on page 6 shows an itemized list of major changes. I won't go through each of these, but I will highlight just a few notable items. First, as you heard last week during the fiscal briefing, the overall state budget includes funding for cost of living adjustments, bonuses, and some annual salary reviews. And I will note that that funding is actually not shown on this chart because it is centrally budgeted under the Department of Budget and Management. But the Maryland Department of Health's share of that funding will be added to the budget in later in fiscal 23. I'll also note that MDH's overtime expenses are increasing. A lot of this increase is due to more workforce needs due to the pandemic. There is a proposed deficiency appropriation that would add $8.9 million for overtime in fiscal 22, and that's mainly for personnel in state health facilities. So then just to go over a few of the department's other expenses, there is $50 million in new funding for the first year of the Maryland Consortium of Coordinated Community Supports. That's shown on this line here, and that is a blueprint initiative, and so that's the first year that this is being funded. I'll also highlight that there's $15 million in the budget for Health Equity Resource Communities grants, and then I'll jump ahead to some of the public health funding in the budget. Under Prevention and Health Promotion Administration, this is where you're seeing the largest decline in COVID federal funds. And that's mainly as grants from the CDC for pandemic activities like testing and contact tracing, and the state's vaccine efforts are ending in fiscal 22. So that's causing a lot of the decline in the budget for fiscal 23. There is also some new funding under public health services. There is funding for school-based health center grants, as those are transitioned from MSDE administering that program to the Maternal and Child Health Bureau, now administering it in fiscal 23. Other sources of new funding include a little over $6.6 million for tobacco prevention and cessation activities. And then not shown in this specific area, but there is also enhancement funding for local health departments. The funding that goes through, there is funding in the budget that goes through a mandated formula But this year, the allowance includes about $7.5 million in funding above the mandated formula amount. And so there is enhanced funding for local health departments. And then moving to the Medicaid budget, here you're actually seeing the budget grow by $203 million. This includes funding to provide the mandated 4% provider rate increases. Again, that was talked about in the fiscal briefing last week, but MDH's budget fully funds the mandated provider rate increases. That applies to the Behavioral Health Administration providers, DDA, and then Medicaid providers. This amount also includes rate increases for dental services and for physician evaluation and management rates. In past years, the physician E&M rates have been about 93% of what Medicare pays, but this year it's increased to cover 100% of Medicare rates. So then moving on to discuss some of the federal fund stimulus that MDH has received. On page 11, this outlines a couple different sources of federal stimulus. I won't go through all of these either, but I will highlight that the largest source of federal support throughout the pandemic has been the 6.2% enhanced federal matching that Medicaid has received. And so this enhanced match is in effect throughout the National Declaration of a Public Health Emergency. When the budget was introduced, it was expected that declaration would end mid-January, but of course that's been extended another 90 days into mid-April. And so this actually allows for the 6.2% enhanced match to go through the end of fiscal 22. And so I think this was talked about last week, but that basically means that the extra quarter of enhanced funding means that there's about $100 million or so in general funds in the Medicaid budget that won't be needed, as that will be covered with additional enhanced federal funds. The other place where Medicaid programs are receiving an enhanced federal match is for home and community-based services. This is a provision of the American Rescue Plan Act, but basically for 1 year, Medicaid has been able to receive a 10% enhanced federal match specifically on home and community-based services. And this funding must be reinvested into those services. But MDH has until fiscal 24 to complete the reinvestment of that funding. But that is also another source of federal aid that is estimated to provide about $400 million or so through fiscal 24. And then on, let's see, just trying to see if I want to highlight anything else from here. There was substantial amounts of grant funding from the CDC that I'll highlight. And then otherwise, there is also some funding that was provided for mental health services. And I just wanted to highlight that, as that is also another area of health that's been highly impacted by the pandemic. Next up, I'll look into Medicaid enrollment. So one of the conditions for states receiving that enhanced 6.2% match on Medicaid spending is that Medicaid programs aren't allowed to disenroll people from the program while they're receiving the 6.2% enhanced match. And so that is also extended through the end of the fiscal year. And so you're going to see eligibility redeterminations start back up in Medicaid beginning on July 1st. But I just wanted to highlight some of the Medicaid enrollment trends. You can see that the pandemic caused pretty large increases in Medicaid enrollment at first, but more recently in 2021, it's kind of leveled off. But there's still between 8,000 and 10,000 people or so being added to Medicaid every month. This next chart shows total Medicaid enrollment over the years. And because when the budget was introduced, it was expected that the National Public Health Emergency would end in April. It was expected that enrollment would fall as redeterminations start back up. And so the budget's based on about 1.5 million Medicaid enrollment. But you've actually, more recently in fiscal 22, it's actually been about 1.625 million people in Medicaid. So next up, I'll actually turn it over to Andrew Garrison, who will present on some recent personnel trends in the department.
Thanks, Ann. So what we're showing you in Exhibit 1 is we're looking at the current MDH kind of cohort is what we're calling it. So we are able to take a snapshot of everyone who's working for the Department of Health as of January 1, 2022. And what we're showing here, first off, is that a lot of the workforce is relatively new in their career with the state. About 40% of the total Department of Health workforce has been with the state for 4 years or fewer. And then when we go into that next category, that second bar, that 5 to 9 years, that's another 20%. So those two together, we have most of our health department employees being with the state or with the Department of Health for fewer than 10 years. And that is true when you look at the 3 different categories in which we broke it up into. And so we wanted to focus on people who have perhaps different experiences throughout the health department. So those who are working in our state hospitals, working directly with patients and doing those patient care and delivery. Then we also do have some portion of the state's public health workforce on our books. Certain local health department employees are kind of dotted line to the state. They're traditionally non-budget, but we do have some data on them. And then we do also have administration folks as well. And in that section, I also included individuals who have a more regulatory role with the state. So those folks at OHCQ who are doing those nursing home surveys, they're going to be falling into that administration category as well. And once we had this data for this current cohort, we wanted to compare it to prior to the pandemic. And that's what we do in Exhibit 2. Given that the pandemic obviously had an impact on our state's public health workforce and their day-to-day operations, what we did is we took that 22 report and we compared it to a similar snapshot that we saw in January 2020, which would obviously be before the pandemic. And what we were able to do with that data is track the essentially the employee ID numbers from those folks who were on the books in 2020, and then compare them to who is still there in 2022. When possible, we accounted for any sort of transfers that we saw in the data. And so what we're showing here in Exhibit 2 is how many of those folks have left the health department by our data from 2020 to 2022. And what was really interesting is that, as you can see, the public health workforce actually had the highest rates of those leaving. So those are people who are at those local health departments who had a day-to-day really impacted by the pandemic and really had a big role to play. About 1 in 5 of them from who are on the state books are no longer with the state in 2020. And those rates are a little bit lower when we look at the administrative, regulatory, or the hospital staff, although those folks who were going into hospitals every day still had a little bit higher of a leave rate than our administrative employees in the state's budget. And then lastly, on Exhibit 3, we talk a little bit about Department of Health vacancies. And what we're highlighting here is we have historical all the way going back to 2018. And as you can see, this isn't necessarily always the case. But currently, we have a higher vacancy rate with our folks who are working in our state hospitals. That's that blue line on your screen. And because they have more of the overall positions in the health department, it's about a 60-40 split. When those vacancy rates increases, that it drives the overall departmental vacancy rate, which right now is hovering around 13%, with a little bit lower share of those vacancies existing in our administrative or regulatory roles. And that is all that I have for the personnel data. And I'm going to turn back to Anne to talk about some of the issues overall.
Great, thank you. So for our analysis every year, we try to highlight just a few items that affect multiple divisions of the Department of Health. So this first issue relates to recent state efforts to expand home and community-based services. And so these are services for people to receive supportive services in their home rather than in nursing facilities or state health facilities. As I'm sure this committee knows very well. This is largely supported through Medicaid waiver programs. You'll see listed here are the 3 under DDA, and then there are some programs under Medicaid that provide home and community-based services. And then there's also the autism waiver that is administered by the Maryland State Department of Education. So first I'll highlight kind of the extent of some of the waiting lists under these programs. First, for Developmental Disabilities Administration, their community services waiting list has declined in recent years, especially you're seeing over 2018 and to 2020 as the administration brought on 2 new waiver programs, but they are still keeping a list of over 3,500 people with developmental disabilities who are not receiving services other than case management while they're on the waiting list. The next program I'll talk about is the Community Options Waiver. In the 2020 Joint Chairman's Report, it was requested that the Hilltop Institute provide a cost-benefit analysis of expanding this waiver program. And as part of this analysis, Hilltop found that there were 19,800 people on the waiver registry and that was as of September 2020. Now it's now above 21,000 individuals on the registry as of November 21. However, they also noted that based on financial and level of care requirements to enroll in the program, only a little more than 3,000 people, or 15.6%, would have likely been eligible for a slot if it was offered to them. And then I'll jump over, there's an exhibit here on page 20, and this shows one of Hilltop's other findings, which was that the Community Options Waiver Program doesn't typically fill its full occupancy, or it doesn't typically fill all of its waiver slots. This shows that the slot occupancy shown through this line graph that shows that slot occupancy has ranged between 70 to 80% since 2017. So previously, MDH has described a couple reasons for keeping some slots open. One of those is that it makes it easier to fill slots in the future, as it wouldn't need to apply to the Centers for Medicare and Medicaid Services every time they want to add someone new to the program. And then the department is also has also talked about trying to shift its registry and how it takes people off of the registry from a first come, first served methodology to one where it prioritizes people based on need for services. There have been recent efforts, though, to expand home and community-based services. I will highlight just a few of these items listed here. Over fiscal 22 and fiscal 23, the budget has included some funding to expand community options waiver slots. In 22, the budget included about $10 million to add 400 additional slots. And then in fiscal 23, there's additional funding to add another 400 additional slots on top of that, in addition to providing funds for additional staff. And then the other thing I'll highlight here is that the fiscal 23 allowance includes about $30 million for DDA to have new placements and provide additional services under its 3 home and community-based waiver programs. So then I'll also talk about the enhanced 10% federal funding that I described earlier, the way that MDH is using that funding specifically. So in last year's budget, there was budget language that basically said 75% of the funding that comes from this enhanced match must be used on one-time rate increases for home and community-based providers. And so you're seeing that this applies to DDA, behavioral health providers, and then certain Medicaid providers, and it ranges from 5.2% rate increases to 5.5% rate increases. And so there is funding in the budget to support these rate increases that took effect November 1st of 2021. For that other 25% of the funding, there was language specifically on DDA's budget that the remaining 25% has to be used on grants to providers. And through spending plans that the department has sent to CMS, they've described a couple different uses of these grants, including, well, I have them listed here, so I won't go through all of them, but on page 23, you can see different ways that the providers could use these grants that will also use this enhanced federal funding. So then I'll briefly go over the second issue that has to do with maternal mortality rates. We wanted to highlight this as an issue this year because recently maternal and child health has been selected as one of the state's population health goals as part of its statewide integrated health improvement strategy as part of the total cost of care model. And this has created some new funding opportunities to specifically address maternal mortality. In terms of state legislation, I want to highlight that there was a bill requiring Medicaid to extend medical and dental coverage for pregnant women. Currently, it's set at 60 days postpartum, but this would extend it to 1 year postpartum. And Department of Health plans to submit a state plan amendment and basically make this change effective April 1st of this year. And so there is funding in the budget to do so, to extend postpartum coverage to 1 year. And then there is also, because of the selection of maternal and child health as one of the state's population health goals, as part of this, the HSCRC has reserved funding for programs that support maternal and child health. There will be funding that gets distributed through Medicaid and MDH's Prevention and Health Promotion Administration for different programs that support maternal health. And so I have these highlighted here. This includes home visiting, and then also coverage of doula services, And then under the Prevention Health Promotion Administration, in terms of child health, this will support asthma home visiting programs. And then for maternal health, it supports a program for eliminating disparities in maternal health. Other than that, the report includes an update on the Cigarette Restitution Fund. But with that, I'll conclude the presentation, and I'm happy to answer any questions.
Are there questions from members of the committee? Delegate Karen Lewis-Young, followed by Delegate Kelly.
Thank you, Mr. Chair. In situations where we receive funds through a federal waiver and those funds aren't utilized, what happens to them? And I'll give you for example. So the self-direction program in DDA, all participants get a budget, but then some of the components are denied. So the participant never gets to utilize their budget. What then happens to those funds?
For the way that DDA's claiming works through its waiver programs, it claims 50% federal matching for its expenditures. So if it doesn't approve those components, I believe it wouldn't show up as general fund spending. And so it's not like DDA receives the funding and then has to send it back. I think it's just the federal government reimburses DDA for its spending. So they would claim 50% of whatever it spent on qualified purchases. So I don't think it's a matter of sending federal funds back in that case. I think they wouldn't have been reimbursed for it in the first place.
Thank you.
Delegate Kelly, followed by Delegate Cullison.
Thank you, Mr. Chairman. Thank you. My question is for Anne. First of all, wonderful presentation. Really, really appreciate it. I'm hoping you can provide me with a little bit better understanding of what the description of the community options waiver changes you were giving means, particularly maybe as it relates to the federal money for home and community-based services. But from what I understand, and tell me if I'm wrong, we have spots on the waiver that are not being filled and have not been filled. We know that there are at least 3,000 individuals who meet the income and assets test, or who would meet the income and assets test, who are not getting services. There's spots for them, but we're not filling them. And we are adding 400 spots with the budget. Does that mean we will also be filling them? And how does that relate to the extra federal funding?
So in terms of the funding to expand to 400 additional slots, that's not using the enhanced federal matching funds. So that is separate funding. The enhanced federal funds are being used on a rate increase for home and community-based services. And then the other portion of funding, MDH is still kind of determining how they'll use the rest of that enhanced match. So that's kind of a separate pot of money. In terms of filling slots, though, part of the budget for this year includes money for additional personnel. I think another issue has been kind of the capacity in the department to take people off the registry. And so I think in terms of filling slots, I think the personnel funding to fill, I think 12 more positions over 2 years is trying to get at that issue in particular.
Brief quick follow-up, Mr. Chairman.
Certainly.
So just so we have 12 personnel being funded, and our hope is that will ensure that we are closer to meeting the now higher cap for filling those slots. And that will take that 3,000 number, which is 20,000 people on the wait list, about 3,000 we think actually qualify, and make that closer to 2,600 people this year.
I believe that's the case. So I believe the personnel is being added to help, because when you take people off the registry, I think some of the kind of bottleneck and the delay comes from assessing eligibility. And so I think the personnel specifically on that issue. So I believe the goal is to fill those slots with the personnel.
Thank you very much.
Delegate Cullison, followed by Delegate Zaliga.
Thank you, Mr. Chair, and thank you, Anne. This was an amazing report, and I can't go I can't wait to go read the whole thing. And you were really clear, so I appreciate it. But I want to make sure that I heard something correctly. In the Medicaid enhanced matching in general, not specifically related to waivers or anything, I think I heard you say because of the enhancement, we as a state have $100 million in Medicaid that we are not, that's available to us now. Is that, did I hear that correctly?
Yes, the extra quarter of enhanced matching means that there's currently budgeted $100 million in general funds in fiscal 22 that will be eventually covered with federal funds. So those will be saved and won't be needed in fiscal 22.
Thank you very much. That is very helpful.
Delegate Saliga, followed by Delegate Bagnall.
Thank you. Thanks for being here. Two quick questions. And I don't know, Anne, if you're the right person to ask or whether it's the Department of Health. I see there's information on page 35 about COVID spending. I have a bill from a student at University of Maryland, College Park, who was required to get a COVID test. And the bill for a COVID test is $1,250. So that's crazy, right? I mean, $1,250 for a test for COVID that he was required to take. So is the state paying $1,250 per test, or is it, you know, I was very concerned from a public health perspective because obviously we're providing a lot of COVID testing for free, which is great. But is there gouging going on? Do you know? Can you point me in the right direction?
I don't want to answer incorrectly, so I'm going to just say that I would have to look a little bit more into that issue in particular. I know there is funding for Department of Health to support testing sites and support the purchase of tests, but yeah, I can't speak directly on the amount per test or the cost of those things. So I would, I'm sorry, I'm not able.
I know, I assumed you couldn't answer that. So, but I don't know, again, if it's you, I ask, or the Department of Health. We have a testing site right here outside our building, which is wonderful. You can walk right in and get a test, but I don't know where this, and it's two people, two different facilities that charge $1,250 for a COVID test, not seeing a physician, nothing more than a COVID test. So, and offline, if you can kind of point me in the right direction for that. And then finally, I'd just like to make a comment, not to you, Anne, but whoever wrote this report keeps talking about pregnant people. You called them pregnant women, thank you. But people don't get pregnant, women do. And so please pass along my comment that I'm a women's rights person and I'd like pregnancy to be for women. And I love it when you say pregnant women. Thank you.
Delegate Bagnall.
Thank you, Mr. Chair, and thank you for this presentation. I just wanted to circle back on the 6.2% enhanced match for Medicaid behavioral health and to make sure I understand something that you said. You said that the Medicaid match did not allow for disenrollment, but does it allow for a change in qualifying services? So, for instance, we had a change in eligible services, but that didn't actually disqualify us from the match. Is that correct? It's only disenrolling members from Medicaid that would disqualify us from the match.
Right. It's on the people specifically. Yeah, I don't believe it has to do with the services. So yeah, I think it is. It is just on disenrolling individuals in the program.
Okay, thank you.
If I may, one last question. I don't see any others. We've heard in general about vacant positions in state government. Do you have specific numbers with regard to the Department of Health, particularly first line carriers?
I think I'm going to pass it over to Andrew if he has something to say on that. I can't remember if the chart earlier had the total department vacancy rate, and if it doesn't, I can definitely get that to you all as a follow-up. But Andrew, if you wanted to say anything about department-wide vacancies.
Yeah, thank you for the question. So the department-wide vacancy rate is hovering right around 13%. And when we're talking about the total individuals, yeah, we have and it's a little bit higher again in those folks who are at the direct care workers. That's at 13.3. Department-wide's at 13, and then we're a little bit below that with the administrative folks. Those are at 12.3. In terms of the actual vacant positions that would represent, we're talking about total positions of about 36,000 on the healthcare workforce side of things. And so 13% of that is, I can just do that math really quick, about 500.
And are there any special efforts to, since these are first-line care providers, to address that by the department?
Yes. So, well, not necessarily the department, but some work that you all did 2 years ago, chapters 576 and 572 of 2020 helped the hospital workforce, particularly in the state. That has included some salary enhancements to those folks at our state psychiatric facilities. Most directly, it ended up being about $30.5 million that's going to support salaries there. That is something that we are reflecting for the first time in the fiscal 22 budget, and it carries over, of course, into fiscal 23. And then, of course, as Anne mentioned at the top two, the governor has talked about agreements reached with the different bargaining units throughout the state, and those aren't currently reflected in the budget that we put in front of you all today, and it's still budgeted in the statewide enhancements, but those are also going to be going to our hospital workforce as well.
Okay. Delegate Crabb, followed by Chair Pendergrass.
Thank you, Mr. Chair. I'm looking at page 16, and I used to think I understood this, and now I think I don't again. It has to do with the local health departments and the relationship with the state health department. And you have your chart here about the transfers, but then in the paragraph below it, it says, while much of the local health department workforce is classified as state employees, there are only 9 active state employees at Prince George's County Local Health Department, and only the chief health officers in Baltimore City, County, and Montgomery are considered state employees. All other local health department employees in these jurisdictions are employed by the local jurisdiction and will not be captured in this exhibit. So 2 questions. Number 1, where does the money come from to pay these folks? And number 2, who controls the position? I mean, who hires and fires and who oversees and administer the local health departments?
So I guess your first question on where the funding is. So the state provides the annual funding formula to local health departments. That's not tied to personnel or staffing, or, it's for operational costs, but it's not tied specifically to personnel. Over the past few years, I believe the state has provided funding for cost of living adjustments and things like that for local health departments through that, on top of that formula. But there is a local share amount, and I believe it would be covered with local funding.
So who makes the decision? Does a local health officer make the decisions, or who makes the decisions on how that money is spent?
I mean, if it's local funding, it wouldn't come through the state budget, so it wouldn't be I don't believe it would be the Department of Health, but that is something I could look into and follow up on. I'm not sure if I have all the information in front of me right now, but I'd be happy to follow up on those questions.
Thank you.
Chair Pendergrass.
Thank you, Mr. Chairman. My memory on that subject, to answer your question possibly, was in the old days when I was on the council. The state paid the salary, and then at least in Howard County, we added to the salary because it was inadequate to get employees. So both the state and the county at the time were paying for employees. I do not know the status of things today. They may have changed, but it's an interesting question. The question that I have is, do we know if there's any exit interview process going on? I would be interested in why specifically people may be leaving, whether it has to do with stress and overwork, or whether it has to do with daycare, or whether it has to do with working conditions caused by coming from the top down. Do you have any idea about that, or could you get us information?
Could definitely get the information. I'd have to ask the department, and I can check with them on their exit interview process. And it might vary by office or division, but I can definitely ask them about that topic.
Thank you very much. And I know you'll get back to us with all the answers to all the questions so that we can share them with the rest of the committee. Except maybe Delegate Shalega's, which is maybe more personal as a constituent issue. I'm not sure. But actually, we're interested because I don't think people should be paying $1,200 for a test. It's making no sense. So why don't you just have them all together, if you would? Thank you.
Thank you. We'll now move on to the evaluation of the State Minority Business Enterprise Program. Michael Powell, Director of the Office of Program Evaluation and Government Accountability within the Department of Legislative Services, and Michael Rubenstein, who is a Principal Analyst for the Department of Legislative Services, in whichever order you gentlemen wish to proceed.
Thanks, Chairman Rosenberg, Chairwoman Pendergrass, Vice Chairwoman Pena-Melnick. I'll go first and I'll be quick. Thank you for having us today. My name is Mike Powell. I'm the Director of the Office of Program Evaluation and Government Accountability in the Department of Legislative Services. And last month, we published an evaluation of the state's Minority Business Enterprise, or MBE program. As many of you already know, the state has a goal that 29% of contract award dollars go to MBEs. This is the second highest goal of any state after New York at 30%. Maryland came closest to achieving that goal in fiscals 2014 and 2015, achieving 27% and 26% respectively. However, MBE participation has dipped to 14% in fiscal 2020, which is less than half of the state's goal. While that year was somewhat impacted by COVID-19 procurements, the previous 2 years had MBE participation of 15% and 18% respectively. It's important to understand what participation means. Participation is the amount of a contract that should go to an MBE as written in a solicitation and presumably the contract itself. One of the things our evaluation found was that only 5% of contracts have MBE participation goals of 29% or more. Additionally, participation does not mean the percentage of contract dollars that actually get paid to MBEs. Payments can change for a variety of reasons. And we found that 46% of contracts actually make less than the expected payments to the MBEs. So for example, a $1 million contract with a 20% MBE participation, or $200,000, may end up paying MBEs only $150,000. Still in that case, MBE participation would be reported as 20%, even though the payments were only 15% of the total contract value. Our evaluation has a number of recommendations for improving the effectiveness of the MBE program. And with that, I'll turn it over to Michael Rubenstein. Michael led the evaluation team on this, and he has a lot more information for you. So thank you. Michael.
Thank you, Mike. Thank you, Madam Chair, Madam Vice Chair. Michael Rubenstein with the Department of Legislative Services, for the record, talking about the MBE evaluation. Before I dive in, I just want to address a few things in advance. The first is this evaluation, I think, is representative of what we envisioned when those of us who were involved in pushing for the creation of the OPEGA office. It marries the policy expertise from the Office of Policy Analysis with the data analysis expertise within OPEGA. They're a small but mighty office. And I think this process worked very well and generated a very good report. Second, I want to do a shout out to the members of the team. When I first pitched this study, I knew I couldn't do it alone in the time frame that we were talking about. And I was very fortunate to be able to recruit what I consider to be the A-team on procurement issues. And so from OPEGA, we had Tanya Webb and Diana Winter. And from OPA, we had your very own Lindsay Rowe and April Morton, as well as myself. And so I think we're all very proud of the product we produced. And finally, one of my objectives with this report was to provide or create a fairly comprehensive and hopefully authoritative summary of the program. It's a very complicated program. It started in 1978 with 5 agencies and a goal of 10%. It's now over 70 agencies and a goal of 29%, and a lot of things have changed in the meantime. The program looks very different today than it did then. And so it's very hard to find a very comprehensive overview of the program. It was my goal to try to provide that in the report. If you're interested and this is a program of interest to you, I would commend you to chapter 2 of the report, which is about 10 pages, summarizing the program. And with that, I will share my screen. We have a presentation. Everybody see that? Okay. There we go. Can everybody see that? All right. So first, the background, as I've indicated, the program started in 1978. It's been reauthorized multiple times. It is scheduled to terminate in July 1st of 2022. There is legislation to extend it for 2 more years. The last reauthorization had it terminating now and required a disparity study to be done by September of last year. That study was not done in time. In fact, they just awarded the contract in December of 2021. So they're asking for an extension for 2 years in that legislation. So it will be likely extended. The goal, as Mike mentioned, is 29%, which is the second highest in the country. That goal was established in 2013. It is supposed to be renewed every 2 years. GOSBA does do the reevaluation every year, and they have chosen each time to maintain it at that 29% level each time they do the review. The program administration and oversight is really scattered amongst many different agencies. So you have the Maryland Department of Transportation that certifies the MBEs. Currently, there's about 7,200 certified MBEs. The Governor's Office of Small Minority and Women Business Affairs, or GOSBA, establishes a statewide goal and does program policies. They conduct research outreach, and they do the reports of performance every year. And then procurement units throughout the state establish MBE participation goals for each contract, and they also are responsible for tracking the vendor compliance. In terms of why we did the evaluation, as Mike indicated, the MBE participation has been declining in recent years. It reached its peak at 27% in 2014. And as you can see, it has been declining. There are a number of factors, as Mike indicated. COVID was responsible for the most recent decline largely, but there were other factors. In that 2016, you can see it declined a fair amount. That was due in part to a change in the way we count MBEs. At the time, nonprofit organizations established to serve disabled individuals were counted as MBEs when they were taken out of that count. So that dropped the participation rates. But the other factor is, as Mike indicated, what we're counting is at the time of contract award. And what we don't know is what happens after the contract is awarded. And that was one of the goals of this study, was to look at what happens once the contract is awarded, because we'd also been hearing over the years, I've been doing this for a long time, you hear anecdotes from a lot of MBE owners about what happens when the contract is awarded. And we wanted to get into that part of the world because right now, all we're reporting is what happens at the time of award. So we had these research questions. This is the scope of the study. We looked at the process for establishing the statewide goal, the barriers to MBE participation in state procurement, how are individual contract MBE goals established by the agencies, and do they adequately reflect the availability of MBEs in the marketplace, and then what's the experience of MBEs that participate in state procurement. In terms of the sources of data, we got survey responses from about 2,700 MBEs and non-MBEs. We didn't plan it this way, but we actually ended up with roughly the same number of responses from the two groups. We looked at contract payments for more than 3,000 contracts that have ended between 2015 and 2020. We did interviews with senior agency personnel, with procurement staff, and with several MBE stakeholder groups. We also conducted focus groups with MBE owners, and we did extensive review of relevant documents, reports, and legislative history of the program. So in terms of our key findings, 95% of contract goals were lower than the statewide goal. We'll start at the left-hand side. You can see that 830 contracts had 0 participation goals. That's not unusual. There are legitimate reasons for not having a contract goal. There are certain contracts that aren't required to have goals, among them small procurements and emergency procurements. There are also instances where if the item being procured doesn't have an MBE available, then that goal would be 0 for that contract. And you can see that actually the value of the contracts is fairly small. So these are mostly very small contracts. Moving over to the far right, you can see the goal is 29%. Only about 170 contracts out of the roughly 3,000 we looked at had a goal that was 29% or greater. Now, we got contract data from two different sources. We got some from MDOT and we got some from GOSBA. The GOSBA data, which covers a lot of different agencies across the state, didn't have the data by type of contract, but the MDOT data did. So this is just MDOT contracts by type of procurement. And you can see that in general, the goals, which are in blue, the average goal for that industry type, are far below what the disparity study tells us as the availability of MBEs in that industry. And this is, again, the data that Mike reported. Overall, once you look at actual contract payments at the end of the contract, we found that 54% of the contracts paid their MBEs what they were supposed to in terms of the percentage goal for the contract. The remaining did not. And you can see it starts pretty high for the smaller goals, which I guess is pretty intuitive. But as you get to the larger goals, the actual contract payments decline. Overall, 54% met their goal. And I will specify, the contract goal is actually incorporated into the contract. It is a contractual obligation of the prime contractor to meet that goal once that contract is signed. And so for contractors that don't meet the goal, they are technically in breach of the contract. You can see the larger contracts were less likely to have MBE primes and had lower payments to MBEs. On the far left side, excuse me, you can see that for small contracts, MBEs actually make out fairly well. They get almost 90% of the contracts and 90% of the payments on those contracts. Again, those tend to be the smaller contracts, the small procurements. But for the larger ones where they tend to be subcontracting on those contracts, their payments are much smaller. From the survey data, we asked MBEs sort of what are the major barriers to participation in the MBE program. And the number one answer we got was that large contracts are not broken up. MBEs told us, they're small, they can't bid on large contracts, they don't have the capacity statewide to do large contracts, they prefer smaller local contracts. But they said there are too many contracts for the state that are big, that are not broken up, and they don't have opportunities to bid on them as prime contractors. Again, if you go a few bars over, they said there's too few prime opportunities to bid on. They want more opportunities to bid on contracts as primes. And then also they indicated that in that third bar to the left, that generally MBE or prime contractors tend to work with the same MBEs over and over again, and it's hard to break in. And that seems to be one of the major barriers that they're citing. We had been hearing, I've been hearing over the years that certification is an issue, that it's long, it's complicated. We asked about certification. You can see all the way to the right, certification was the least likely thing that they identified as a barrier to participation. There are some issues with certification. Some of the times it runs too long. It can be a 6 to 9 month process. We did hear stories that it can even run longer than that. The statute says it can't be more than 9 months. But for the most part, what we're hearing is it's not a major barrier. So getting to our recommendations, again, addressing that one finding from the MBEs that they don't have enough small contracts to bid on. There is an executive order that was signed a year ago by the governor that requires any contracts valued at between $50,000 and $500,000 to be designated for small businesses. Now, small businesses includes MBEs, but it's not just MBEs. But as you can see from that one slide, for small contracts, MBEs actually make out pretty well when it comes to small contracts. And so we're recommending that we codify that executive order in statute and require that set aside for small businesses for those smaller contracts. The problem with set asides, and we heard a lot about them from the MBEs when we did the focus groups and in the surveys, is within the confines of the Supreme Court decision on race-based programs, you can't do a set aside program. That's considered reverse discrimination. So you can't set aside just for racial minorities, but you can set aside for small businesses in general. Another recommendation is, and this is a non-statutory recommendation, that we're asking agencies to give due consideration to breaking up those larger contracts. There's actually already language in the statute that requires them to do this, but we're just emphasizing that this is something that they should be looking at more extensively. And then also we're recommending that agencies consider piloting a requirement or a preference for joint ventures. Joint ventures are different than a typical contract in that in these, it's a prime contractor with an MBE and they're full partners. So in this case, the MBE actually has a direct contractual relationship with the state instead of being a subcontractor. One of the issues that we ran into is when you're a subcontractor and you don't have a contract directly with the state, there's very little the state can do for you. Everything has to go through the prime contractor. But in a joint venture, you do have that contractual relationship. The state can do a much more extensive job of monitoring your participation in the contract. And we're also recommending that GOSBA should consider expanding criteria for graduation to create opportunities for new MBEs. What we found is even though there's more than 7,000 certified MBEs, there is a graduation process that once you get to a certain size or a certain net worth of the owner, you graduate out of the program. What we found though is even with 7,000 certified MBEs, the number of graduates right now is under 30. So basically there's no churn in the program. There's no people coming out of the program. You just get more people coming into the program. And it makes it very difficult for those new members to coming in to break into the program, as we heard from the MBEs during the focus groups in the survey. So what we're recommending is having some sort of heightened graduation requirements that will move people out of the program and make room for new people coming in. In terms of accountability, we're asking the agencies report the results of their compliance assessments to GOSBA, and GOSBA should publish their aggregate results. These compliance assessments are already required in current law. When a contract ends, the agency is supposed to look at the contract, see how much they paid, and compare that to what they were supposed to be paid for MBEs at the time of contract award. But those results don't get reported anywhere. We asked agencies what they do with those results, and they basically said it goes in the file. So we're asking that these results be reported to GOSBA and that GOSBA summarize them in its annual report so that we can actually see what the actual payments are at the end of the contract term. And then we're asking GOSBA to use that data to develop and maintain a list of prime contractors that, absent mitigating circumstances, persistently fail to meet their MBE contract goals, and that past failure to consistently meet those goals should be considered in determining the responsibility of a firm to participate in state procurement. And there is a provision in the statute right now to allow for the assessment of liquidated damages against a firm that doesn't comply with the requirements of the MBE program. We asked agencies to give us examples of when that had been used, and none of them could give us any. What they basically tell us is it's not a very effective means of accountability because they don't want to antagonize their vendors, and so they don't use that power. So we're just recommending that we get rid of it. In terms of support for MBEs, we're recommending the creation of an MBE ombudsman within GOSBA to help resolve disputes between MBEs and prime contractors. This again gets at the issue that we heard repeatedly, which is that when an MBE has a problem or a dispute with their prime contractor, they have nowhere to go. And we heard multiple stories from people, including some who were very well connected within the state, who said basically they felt like they had nowhere to go. And we're trying to create an office where they have somewhere to go and that has some authority to help resolve their problems with the prime contractors. We're asking that we extend to all contracts, not just construction contracts, the state's authority to withhold progress payments to prime contractors that do not pay subcontractors in a timely fashion. They're already in statute, there is a requirement that for construction contracts only, when a prime contractor does not pay a subcontractor within the 10 days required by law, that there is a mediation process, and at the end of the mediation process, if the state determines that the prime contractor is still in default, they can withhold payments, but that doesn't apply to any other types of contracts. We're just saying this should apply to all contracts, and that will give the state more authority to police their prime contractors. We're asking that GOSBA, is in particular, which does most of the outreach for the state, hold meet and greet opportunities for MBEs to connect with prime contractors. This is something that we heard from the MBEs They want more opportunities to connect directly with their prime contractors so they can try to solicit business from them. And they just don't have those opportunities. And then we did recommend creating an incentive, which would be limited retention of MBE certification for MBEs who are in that graduated status to mentor new MBEs. There was a JCR report from GOSBA a little over a year ago in which they indicated that they had tried on multiple occasions to do a mentorship program for MBEs in which experienced MBEs would mentor the younger or newer MBEs. And they said that they've tried multiple times and it's always failed. And the reason it fails is because they don't have an incentive for the experienced MBEs to mentor their newer colleagues. And so we thought this would be one way to create an incentive. In other words, as you're entering that graduated status, you can retain your status as an MBE for a few years if you agree to mentor somebody. This has raised a little bit of an issue with the AG's office. They indicate that there could be a legal issue in terms of letting somebody who is no longer supposedly eligible to be an MBE to remain an MBE. We're open to discussion on that issue. There may be some ways around it, but otherwise, this may not be feasible, but we'll have to wait and see. In terms of transparency, we're recommending establishing statewide MBE participation goals by industry type. This is an issue for some of the agencies who say basically the 29% goal assumes a lot of construction activity. Construction is one of the industries that has a lot of MBE participation. So if you're an agency that does a lot of construction like MDOT or DGS, you have an easier time meeting that goal. But if you're an agency that does IT work or services or commodities, the availability of MBEs may not be as great. And so, being measured on that 29% goal may not be adequate. And so we're recommending that we can set goals by industry type so that the reporting can reflect that. This is another area where the AG's office has raised some concern, less so legally, more in terms of implementation. They say that setting industry goals may result in some exclusion of some groups from certain MBE contracts. Again, that's an area that we can explore with them further. And then in terms of transparency, we're asking GOSBA to make its goal setting methodology transparent by publishing it on its website. And we're asking that each solicitation document that includes an MBE participation goal include a brief summary of the factors used to establish that goal. That's another thing we heard from MBEs and from prime contractors, that basically they got a contract that says you have a goal of 29%. They don't know where that goal came from. They don't know what their expectation is in terms of what kinds of areas they can subcontract in. This would give them some guidance in terms of where to look. Technology, again, these are non-statutory recommendations. The first one is to prioritize the full upgrade of the state's financial management information system. This is in the very early stages of upgrade. It's probably going to take a few more years, but the system dates back to early 1990s. It's very antique. It's clunky, I think is a technical term. And there are a lot of things, a lot of capabilities that it can't do that would make the reporting and the monitoring of MBE participation much more efficient. And so, this would help across the state in terms of a lot of different capacities, but it would also help the MBE program. And that's why we're recommending that it be prioritized. We also found out in the course of our work that MDOT had developed a automated goal setting program, but it was still sort of in the testing phase and they were only using it very lightly. And they said they ran out of money, so they couldn't finish the development of it. We're recommending that they work with GOSBA in trying to finalize that because automating that goal setting process could save a lot of trouble and also make it more efficient. In terms of unresolved issues, things we really weren't able to get to because they were outside the scope of our study. The first is the possibility that there are MBE fronts. And this is something we heard accusations about from the focus groups, from the surveys, that basically some prime contractors set up MBEs as fronts that get the certification, but they're basically linked to or connected to the prime contractor. And so they're basically pass-throughs to the prime contractor. We don't, we're not investigators, we're not auditors, we don't have the capacity to look into this. But we heard it several times, and so it's certainly something that could be out there and could be undermining the purpose of the program. We just don't have the capacity to look into it. We also heard on a few occasions complaints about bonding, but the overall impression about bonding was actually fairly mixed among the MBEs. We asked several of them, is bonding a barrier to your entry into the state procurement? And some of them said yes, but a lot of them said no. And so that was a little surprising to us because we've heard over the years that bonding could be an issue. But we did hear on a few occasions that people thought the bonding set by the state is too high on a number of projects. Again, this is something that really extends beyond just the MBE program. It really was outside the scope of our study, but it's something that may be an issue that could be looked into in the future. And then the final thing is the timing of the submission of the MBE schedules. Right now, under current law, if you are a prime contractor, at the time you submit your bid or your proposal, you have to include the full list of MBEs that you're going to use and how much of the contract they're going to get. And this is sort of to avoid a bait and switch kind of situation where, which used to be the case, because it used to be that you had 10 days after your contract award to tell them who you were going to use. And there was a lot of baiting and switching going on there. So this was designed to sort of prevent that from happening. But at the same time, it really does create an incentive to overpromise. And we heard that from a number of MBEs and also from prime contractors, where they said, we went in with this group and we found out after we got the contract that maybe an MBE couldn't do the job. Or we heard from MBEs that said, oh, the prime put us on the schedule, but they didn't use us in the end. So it really went both ways. The problem is we don't really have a good alternative to this. Like I said, in the end, in the past, it used to be you had 10 days to submit a schedule, and there you did have a lot of baiting and switching going on. So we're not sure exactly how to address this issue. I think right now we just have to live with the way it is. And that concludes my presentation, and I'll be happy to take questions.
Are there questions for Mr. Rubenstein or for Mr. Powell? Delegate Johnson.
Thank you, Mr. Chairman, and thank you, panel, for coming to explain this to us. This is for Mr. Rubenstein. Is there any preference for a Maryland small business on these contracts? And do we know what percentage of Maryland small business are getting our contracts?
So there is no preference for Maryland businesses in state procurement law. And the reason for that is that we have in place, and a lot of other states have in place, what's called a reciprocal preference. And that is basically if you are an out-of-state bidder, if we give an in-state bidder preference, when a Maryland company goes to Pennsylvania or Delaware, then that state can give their people preference over the Maryland companies. And so basically it's sort of a stalemate among the states that basically says, we don't want to give our people preference because we don't want to disadvantage our folks when they go out of state either. So there is no Maryland preference in state procurement. There have been some legislative proposals to do that, and they've all failed for that reason, basically.
Do we have any idea what percentage of our Maryland small businesses are getting contracts in Maryland?
No, the current, again, with that financial management system, we have a hard time tracking where contracts go. It's just, that's one of the capabilities it doesn't really have. So there's no data on that.
All right, thank you. Thank you, Mr. Chairman.
Thank you, Delegate. Delegate Sligo, followed by Delegate Sample Hughes.
Thank you so much. Mr. Rubenstein, can you define MBE for us? I looked back, I didn't see the actual definition, so please define it for us.
That's something that's in that chapter 2 that I mentioned. It's a fairly extensive definition, but it's basically you have to be a small business and you have to be owned and controlled by somebody who is economically and socially disadvantaged. And there's a whole definition of what that entails. There's also a personal net worth cap that's roughly about $1.8 million now. So if you are an individual who has a personal net worth above that cap, you can't be an MBE, you can't own an MBE. But it's basically a small business that is owned and operated by somebody who is economically and socially disadvantaged.
Can you send all those categories to us in an email?
Sure.
Whatever's in that lengthy list?
Yep.
And I noticed on slide 11, you talked about graduates move not enough churning. So we had an initial MBE net worth, I think it was $1 million. And I thought it was moved up to much more than 1.8, but it's 1.8. Do you think, go ahead.
It was originally 1.5 and then they indexed it to inflation, so it goes up every year. So
Okay.
the inflation rate is up to 1.8 million.
1.8, okay, because I know at one point there was a bill to make it much larger than that. And I don't know if that would be part of that, but under your unresolved issues, I applied for my MBE in the 90s and was denied. So I'm familiar with the process and how it used to work, and we could have an offline conversation about that. But there was an issue about how much my MBEs were paid less the contract, and that at the end you kind of got into, the timeline for bidding and an MBE accepting part of the job. Did you ever look at the reason that may have happened was the MBE couldn't or didn't finish the job, so their contract was less? I know my companies come in behind an MBE that bid a job and they couldn't keep the schedule, so then they hire companies to come in and obviously charge them back for the time. Is that part of why we're having that problem?
That is definitely one of the reasons. There's a number of different reasons, but that is definitely a factor. We did hear that from some of the prime contractors that one of the factors is, they go in with a team and they find out that maybe they're oversubscribed on some contracts or something else happens and they can't do the work and they have to go out and find somebody else. And so that is a factor. And that's why when we say that, we want to identify those who don't meet their goals on a persistent basis, we limit that to, there can't be any mitigating factors, and that would be a mitigating factor. Whereas if it's not their fault, they wouldn't necessarily be identified.
And finally, are you going to continue this study into this program? I mean, it's very important that we make sure that we're meeting our goals, which clearly we aren't and can't. Why, or is this the end of your work on this?
This is the end of the work for now. There is legislation. I think you're going to hear a bill right after this presentation that implements a lot of our recommendations. If in particular that reporting recommendation is adopted, we will start seeing more data coming in those annual reports, and that will be helpful in terms of tracking the program. At the same time, I did a presentation on procurement for B&T a few weeks ago. One of the questions I got was about vacancy rates in procurement. And so I did some research and we got data from across state agencies, including MDOT. The vacancy rate for procurement staff is 20% right now. They're pretty oversubscribed. There's a lot for them to do. The emergency procurements that we saw for COVID really taxed their capacity. But we'll certainly, I've been doing this work for 16 years. And we'll keep an eye on it, but it'll be interesting to see if we get more data.
Great. Thank you for your work. Thanks so much.
Sure.
Thank you. Delegate Sample Hughes.
Thank you, Mr. Chair. And thank you so much for this report today. It's very extensive and I really appreciate the recommendations and really looking at this holistically. With regards to the Ombudsman program that you've referenced and the ability for contractors, MBEs, I should say, to be able to have a place to go and to be heard. Have you, and maybe you shared this and maybe I overlooked it, but the number of disputes that you are aware of or your office has been aware of where this has been a problem? Case in point, I had a couple of them that were not construction related, but wanted to go straight to the Board of Public Works with their concerns and their appeals, but that obviously is not the process. So this is necessary. So I just wanted to ask you if you had quantified that.
We don't have any firm data on the number of disputes. We do have a few things from the survey that we collected. 2/3 of the MBEs said that they were paid what they were supposed to be paid. So that leaves a third that were not. So that was one piece. And also 20% of the MBEs said that payments from prime contractors are either never or almost never paid on time. So on the one hand, you can say, well, it's only 20%. On the other hand, that that's if they're saying it's never or almost never paid on time, that can be a problem, especially for small businesses that have cash flow issues. We do have a sense that there is an issue out there. We don't have firm numbers on how much, but it's definitely something that is more prevalent than we'd like to see.
Okay, thank you. And then my second piece, real quickly, is just regarding where you indicated that the contractors breach the contract when they don't meet that goal. So did I hear you correctly? And you said that we don't have right now any way, any repercussions at this time to address that issue, and your recommendation is for their payments possibly being stopped. Is that correct?
So on the first point, there are two avenues that an agency can take when a firm is not meeting its MBE goal. The first is they can cancel the contract. Agencies told us they don't want to do that. They're often reliant on that work getting done. And they're still going to be beholden to that contractor to pay for what they did, and they don't want to have an unfinished product and have to go back out and rebid the project. So they don't cancel the contract. The other one is, as I said, the liquidated damages. And again, that's something they don't use. They don't want to antagonize their vendors. None of the agency people we talked to could even remember a time when liquidated damages were used. Those are the two avenues they have. They're not being used. So what we're recommending, two things. One is for vendors who aren't paying their people on time, their subcontractors on time, the state could withhold payments from them. That's already possible under construction contracts. This would be possible under all contracts. And the second thing is this list that we're talking about that GOSBA would keep, identifying vendors who are persistently negligent in meeting their MBE contract goals. They would be put on a list, and they would essentially not be eligible to participate in state procurement for a certain amount of time. And we're leaving that up to GOSBA to decide. We put in the bill that they can develop recommendation or regulations on that. So a lot of the details on that would be up to them, but that would be the other mechanism that we have in place for our recommendation.
Okay, thank you. Certainly we have to just hold GOSBA accountable so they don't put the paperwork and information in the drawer. Okay,
Yep.
Thank you so much. Thank you, Mr. Chair.
Thank you. Mr. Rubenstein, you indicated that there is a bill that incorporates some, many, most of the recommendations. How would you describe the bill that I also believe you said we're about to hear at our 3 o'clock?
Yeah, Delegate Wilson, I think, has the bill in. There's a cross file in the Senate from Senator Griffith. It implements the statutory recommendations from the report, which are, I think we had 19 recommendations. I think 10 of them are statutory. The rest are non-statutory. They're basically administrative. But of the 10 or so statutory recommendations, it implements all of them.
Okay. Thank you very much. Seeing no further questions, we will be recessing or adjourning this briefing. The full committee will meet at 3 o'clock. Thank everyone for their participation. We'll see you again at 3 o'clock. Thank you.